Good morning and welcome back, everybody. It is Wednesday. I had a couple weeks off from doing the lives and it was great. So it gave me some time to work on some of the other things inside of the group, organize the month schedule for our lives and all the various posts that go up month to month. Okay, so just a quick little reminder that just above the banner of our group, there just below that banner, we have a section called guides, and I just want to remind everybody that everything is so neatly filed in the guides section, and it gives you all the titles of the primary things that we cover. So all the lives are under there, all the recipes, all the challenges, all the great and wonderful things that this group has collected over the last 3 years. So Coach Penny and I have a great program that runs here inside the free group. So if you have a quick look at the guides section, if you're looking for exercises, we have a whole guide section in there, everything from like 1 minute things up to like 45 or 60 minutes worth of exercise. So there is lots of great things. So please, have a look in that guides section because, like I said, Coach Penny and I have really put together some wonderful things, everything to do with healthy lifestyle and moving you towards your primary goals. Okay, so for today's topic, you guys asked me to talk about thyroid dysfunction. So thyroid dysfunction comes in a big bag of goodies. And there is so much to talk about. So I'm going to talk about some of the primary things. We're going to touch on things like pathology, symptoms, thyroid health, what affects the thyroid and how it, starts to become dysfunctional. And a lot of clients that we work with, and then a lot of people who are in the free group as well, suffer from usually underactive thyroid. So that's hypothyroidism. That is just one of the primary pathologies that can present itself, but is one of the most common ones that women deal with. So the underactive thyroid. When you have an underactive thyroid, as most of you know, one of the biggest symptoms that women will complain about is the weight loss. So having issues with weight loss, and the opposite as well, the weight gain. So I'm going to touch a little bit about that today. And first, what I want to talk about is the pathology, and what the pathologies are first. And I just mentioned the first primary one is hypothyroidism. So that's the most common one that we see generally in our practice. Hyperthyroidism is usually you see hyperthyroidism for a brief moment. It'll turn up in the your symptoms and things where everything just feels really revved up. You could feel like heart palpitations, you could have weight loss, the opposite of hypothyroidism. So your furnace is really like on fire. Okay, but then that lasts for a short period of time, and then all of a sudden you go into hypothyroidism, underactive thyroid, which everything just slows right down. Okay, and we'll talk about the primary symptoms that come up. The other pathology also is autoimmune diseases. So things that will show up in autoimmune are things like Hashimoto's disease and Graves' disease. And then the fourth one is thyroid cancer. Okay, so those are your top pathologies, but like I said, hypothyroidism is the most common one that is seen. It also is a metabolic problem, and also with autoimmune is a problem due to other things outside of a metabolic issue. So we'll be focusing a lot more on looking at hypothyroidism, since that is the most common one and the most common thing that we see in our clients. So when our clients come to us, usually they have hypothyroidism, they have high cholesterol. I did the talk on high cholesterol not too long ago. And then there'll be some other elements that are attached to that. So primarily like pre-diabetes, high blood sugar, or diabetic. Sometimes we see that as a combination. High blood pressure, some of the common things. Are those like life sentences? No. And people think that because they get, certain diagnoses and then, they have that medication or whatever, that is a lifetime thing that, they're going to be stuck with. But it's not. Coach Penny and I have had the opportunity to help people reverse various things such as those diagnoses based on helping them work on various lifestyle changes inside our coaching programs. Okay, so first we covered the pathologies, and then what we also want to look at is what causes the loss of the thyroid function. So the loss of the thyroid function can be affected by things like autoimmune disease, no thyroid glands. So some people have had thyroid removed. I've had clients in the past have the thyroid removed. Postpartum thyroiditis, various medications that you're on can affect the thyroid and the loss of function of it. Toxins in your environment. I did a toxin talk, I think a couple of months ago, and toxins are a big key thing that can affect the thyroid, especially when it comes to things like herbicides and pesticides. That's why we do talk a lot about organics, and we talk about the chemicals that you use to clean your home, or the chemicals that you can't control in the environment, and other chemicals that show up in foods, like rice. Non-organic rice is a common one. You'll see things like arsenic in that. Also, with water, one of our key fundamentals inside our coaching program. We always make sure that we're making sure that the clients are getting water, but it's not just the water, it's also like the quality of the water and where it's coming from and how it is filtered by you yourself, and what your primary resources are, because the chemicals inside the tap that come out of your tap have components that can affect the thyroid. Right down to things such as the foods that you eat. Of course, I did mention like what chemicals show up in foods, like all the farming and agriculture, how the way things are farmed and agricultured, all the chemicals that are used to spray, fertilizers, things like that. But another big common one that is a huge thing, and also a key component inside our coaching program that we teach our clients, one of the key fundamentals in that is eliminating and reducing. Elimination is key. That's actually optimal, not so much the reduction. The reduction happens over the coaching program as we work on your mental health, to help you move through things that are sticking points. But one of the key fundamentals is getting rid of inflammatory foods. And one of the inflammatory foods that we recommend getting rid of is gluten, because gluten attacks the thyroid gland. It attacks it, and what happens is over time that's going to cause dysfunction, and it can go into serious problems such as autoimmune disease. Okay, so it goes from a metabolic issue to then an autoimmune disease. Okay, so we talked about toxins, stress. So the people don't really realize, like, that running around with your hair on fire for the majority of your life is all about stress. So the stress, and stress shows up in so many different components. Everything from chronic pain syndrome to your outside stimulus in your environments, the things that are coming at you, but most importantly how you're dealing with things on the inside. And again, that goes back to the mental fitness of how to work through things and not run around with your hair on fire, as Coach Penny uses that analogy a lot. So stress shows up in so many different factors in life that the poor little thyroid just gets affected by that. And when we talk about the thyroid, we also talk about the adrenal health. So if you're not aware of what the adrenals are two glands that sit on top of your kidneys, and they regulate the hormones for stress, okay? But the stimulus comes from the brain. So you have glands in the brain that send chemical messengers down to those glands to say, okay, hello, let's pump out some more of that, that cortisol. Let's pump out that adrenaline and norepinephrine and those types of things. So the brain is the stimulus, right? Because it it is bringing the outside stimulus, what you're reacting to out here, to the inside, and then it's creating that chemical reaction. But your thyroid gets affected by that. So again, it's a vicious little loop. So when it comes to thyroid health, we have to also manage and learn to understand how to manage stress properly. So, that 10 out of 10 stress that a lot of women will actually say, oh no, my stress is like 5 out of 10. Coach Bunny and I are like, no. let's reevaluate that. And let's bring it to reality. And once we see and understand that reality, then we can better manage the lifestyle in itself. So it's important to manage the adrenals and the adrenal health, so that it can then not affect how the thyroid operates. Blood sugar control is another way of managing thyroid health. I've talked a lot about blood sugar over the number of months. So blood sugar, and I talk about then managing insulin, and then of course then that also relates to high blood sugars, pre-diabetes, diabetes, like I mentioned. So managing your blood sugars is super important, and really learning to understand how to level the blood sugars. Stopping the blood sugar roller coaster, so a constant blood sugar roller coaster. And that's why inside the coaching programs that we do, one of the key fundamentals is understanding food timing, understanding your cravings, and understanding how to close the gaps of your meals, and making sure that the blood sugar is leveling off. That way, then the thyroid health is one of the things that are checked off your box, to make sure that your blood sugars are not out of control and affecting your thyroid function. Okay, so far we've hit. Oh, actually, I haven't. I got past stress. I had 2 more points I wanted to make under what causes loss of function. The nutritional deficiencies and the excesses. And we're going to actually talk a little bit more about nutritional deficiencies a little bit later in this discussion. And thyroid hormone resistance. That means that the thyroid is working or trying to work, but it's then the resistance of what's happening in the breakdown of the hormone, because there's a cascade of how the hormone breaks down in the body. And if there's a disruption somewhere, something is not working properly, then somewhere along that cascade that's causing a problem. Okay, so again, it can be like a deficiency of some sort, stress, whatever is intervening in there can cause that resistance. So it's not maybe getting to the tissues. The hormone isn't maybe active as much as it should be. All those types of things. Okay, so now that we're kind of learning to understand a little bit about how it all kind of works, we're going to talk just for a moment about the hormones. Actually, no, I'm going to hit up top symptoms first, and then I'll go to hormones. So the primary symptoms, and most of you that are listening in or have asked me to do this topic already know what your primary symptoms are. But the interesting part about that is that the symptoms can be present long before you become hypothyroid. And I'm going to explain that because what will happen is you will have your standard care of testing. I said standard care of testing from your general practitioner, which is your TSH. That's your thyroid stimulating hormone. That's a standard test of care. That means that they're not testing the other components that make up what the thyroid health looks like. But let me touch first on what the top symptoms are. So some of the key top symptoms that most of you may have experienced prior to your diagnosis of hypothyroidism, or more prominently, you got diagnosed and then here's all your symptoms, right? So depending which one, it was the egg or the chicken or egg, whatever came first. Okay, so fatigue, how many of you, and you guys can comment below. So if some of these symptoms resonate with you, just write your symptoms down below. So fatigue, weight gain is a big one with our ladies, feeling cold, dry hair and skin, hair loss, menstrual irregularities if you're still menstruating, edema, so swelling, and that swelling can show up like in places like the face, it can show up in the lower body, things like that. So depending on what the dysfunction is. Muscle aches, joint and pain. Again, a lot of our ladies show up with that as well. Constipation, that's another one. We've seen all sorts of issues with the elimination of the digestive system, where when you go to the bathroom, you should be pooping regularly every day. That's regular. So it can be anywhere from 1 to 3 times a day, depending on the person, but we learn to understand your symptomatology, which is your symptoms, when we work with you in the coaching programs. And then we can see like what your norm is and what not your norm is, and then we can work to get that into a regular system. With thinking about like if everything is in if it's hypothyroidism, which these are the symptoms of hypothyroidism, everything is down regulated, like nothing is working optimally. So of course, naturally, your detoxification system, which is also you're pooping every day, is going to be affected. It just gets all slowed down, and then you're not eliminating out of your body, which is super key as part of your detoxification system. So your liver does a ton of work for you, and if things are sluggish and slow, you're not eliminating those toxins. Okay, so the toxins are also internal toxins that you produce naturally from the breakdown of things happening in your metabolic system, and or anything that you're adding in from your outside environment that you're putting on your skin or you're putting in your mouth and you're eating and whatever, those have toxins in them, right? So your body needs to go through that process to eliminate those things. And then inside our coaching programs, we're teaching you how to then choose better things in your environment so that you're really reducing that load. Okay, depression is another one too. So, depending on the mental health, again, Coach Penny and I focus on, the mental fitness part of it. A lot of women who come to us, they have anxiety, they're depressed, depending on like the degrees of depression. But a lot of times what we'll see is when we start working on those key fundamentals inside the program, that then, we've seen depression, disappear, and the symptoms sincerely reduced, which is absolutely fantastic. Like just getting your life back, right? Like starting to feel like, a human again. Okay, so now that we've learned to understand some of the symptoms and then some of the key things that go along with those symptoms, I gave you some really great tidbits around that, as far as what to look at when you're thinking about making lifestyle changes and choices. What I would like to do is touch a little bit on a couple more things before we before we wrap up our discussion. So I hope that you're starting to see the clarity of um, why there is weight gain when there is a thyroid dysfunction. Now, what's interesting is, as I said before throughout the discussion, is that as we focus on all the key lifestyle factors inside the coaching programs, and people who have had thyroid problems for many years, or been recently diagnosed, or whatever the case is, like we have one case that we're working with right now, one client. She's had hypothyroidism since her early 20s. She was diagnosed very early in age, but when we look at her history from 20 years and younger, we learn to understand, why that has happened in her lifestyle, specifically around the 10 out of 10 stress factors that she incurred during that. So then naturally, we would see then an adrenal dysfunction. We would see, blood sugar dysregulation. So we would see a lot of metabolic issues that can be controlled by health, your lifestyle choices, which include things like exercise and movement, your habits, which include the things that you're not recognizing that you're doing, anything nutritional, so focusing on the nutrition, doing many different things in the nutrition component to help with that, and then working on the mental fitness, which is our three primary pillars that we focus on inside the coaching program. So with that being said, her case specifically, so she's in her late 40s now. She is overweight, but a lot of the things that were happening in her lifestyle was all dysregulated. So like I said, the nutrition, the exercise and movement, the mental fitness, all that kind of stuff. So once we started to work with her, she's lost 12 pounds now. So it takes a little bit of time, but the dysfunctions and the happenings didn't happen overnight. It was a long time coming. You just didn't recognize them, or you're just not aware of what's happening in the body. And that's why Coach Penny and I really work with intuitiveness and learning to connect inside here to then make those guided decisions about what's coming up for you to help really regulate that. Okay, so what we're going to talk about is the factors that affect thyroid function from a nutritional standpoint. So remember I said that one of the causes of loss of function was nutritional deficiencies or excesses. So what I just wanted to kind of loop back around and revisit some of the key things that can cause loss of function in the thyroid. So some of the key factors that can cause that dysfunction are things like deficiencies in iron, iodine, zinc, selenium, vitamin E, and then B vitamins, B2, B3, B6, vitamin C, vitamin D, and tyrosine, which is which is an amino acid. That's with the amino acids. We are Coach Penny and I are big, if you haven't noticed in the group already, about eating enough proteins so that you're providing your organs and your hormones, the hormones that are actually made from proteins or building blocks of amino acids, that you're getting those proper nutrients, so that you're giving your body the building blocks it needs in order to do the things it needs to do. Okay, so this is where a lot of confusion, and I don't really know how my body operates. It is a well-oiled machine when it is fed the things that it needs to be fed in order to do the things it needs to do. Okay, so, and that's why I say, like, some of the key factors for your thyroid hormone to convert and do the things it needs to do downstream. So remember I said that the hormones, they start with the production in the head and they move downstream. And I'm going to talk in a moment about what that hormone cascade looks like so that you understand how that works in your body. So some of the key factors that contribute to that proper production, going from T4, so T4 is the inactive raw form, to the active form of T3. So if some of you have had the tests, the blood work done, you know maybe like a smidge about T3s and T4s. Like you've probably heard them, your doctor's probably talked about them, things like that. So you might have a tweak of understanding how that works. Well, in our bodies, the way it works, hormones, to get them to work, they need certain things in the body that you provide as well through your nutrition and lifestyle to help them do the things they do. So as an example, like I said, just to reiterate what I'm saying is that to convert T4 to T3, some of the things that you need are things like iron, iodine, zinc, selenium, vitamin E, the B vitamins, B2, B3, B6, vitamin C, vitamin D, and tyrosine, which I said was an amino acid. Okay, so that's factors that contribute to proper production of T4 to T3 in your hormonal pathways. So if those things aren't working, so if there's deficiencies, then those things aren't going to be converting properly, which is then going to cause symptoms, and then that'll cause some of the blood work to be out of balance when your doctor does it. Okay, now what I want to talk quickly about is, before I move into a little bit more about factors that inhibit proper production. So factors that inhibit proper production. It's not going to be news because I talked a little bit about it at the beginning of the conversation, at the beginning of this video. So I like to repeat because when you're consuming this information, it's we hear it once and then we just walk away from it, and then we get we're only hearing bits and pieces of it. But what we're here to do is to make sure that you understand some of the functionings of how these things work, because it's just not a standalone issue. I can't lose weight, my thyroid doesn't work. Well, it's not really how that works. Okay, so symptomatically we learn to understand what symptoms you're presenting, what are the lifestyle factors, and then we begin to help piece it together so that your symptoms change. Okay, so your symptoms change. They subside, they go away, they reduce, whatever the case is. When that happens, then that, as we're attacking your root cause, the root cause that's causing those symptoms, then you're starting to see that transformation. So it's not just a one-off where a lot of women think that, because they have hypothyroidism, they can't lose weight or they're gaining weight or whatever the case is. It's not necessarily a standalone problem. There's other things happening, and it's important to understand how that works. Okay, so when we look at before I go into some factors that inhibit proper production, I want to just talk first about the hormones. Now, with the hormones, when you have your thyroid, so we all know, right? The thyroid gland, it sits here in the throat, okay? So the thyroid gland sits here in the throat, but in the brain, we have two glands that produce hormones to stimulate the thyroid, which then creates a cascading effect to every cell. Okay, so just hold on to that for a moment. Every cell in the body. Okay, so that means that the thyroid hormone T3 needs to communicate to every cell in the body. Okay, so if you guys remember back in high school, when you did things like biology and chemistry and the whole 9 yards, and microbiology and all the things. Oh my God, so long ago. But think about it, those cells are they are your machines. They're little machines, and they require nutrients to produce. They require, or to operate, excuse me. They require hormones to work. So each and every little cell has receptors. And think about this. Those cells, you can't see them, but they make up everything in your body. So if that thyroid is not functioning properly, and it's and you've got your glands are saying, okay, let's produce some thyroid hormone, let's go, let's go, let's go. So it's putting all that pressure on the thyroid. The thyroid's pushing it out, but the conversions aren't happening properly. So going again, so from your raw form of T4 hormone to active T3, which communicates to the cells, and then the body's not communicating the way it should, then like I said, in your symptoms, everything starts just to down regulate. Okay, it's literally starving. Okay. All right, so just to give you a little bit of context and not go too crazy with all the logistics, but we have a hormone called the TRH. All right, this hormone is made by your hypothalamus. The hypothalamus then stimulates the pituitary. And the pituitary hormone that is stimulated there is TSH. Now remember I said back at the beginning of the conversation, I said the doctors in standard care will test TSH. Okay, now I want you to listen very carefully. The TSH is that standard care, all right? But here's the issue with the standard care testing. One, it does not give you the full picture as to what is happening in the whole thyroid picture, the whole thyroid hormone picture, okay? So, you cannot say that there's thyroid problems, quote unquote, just by looking at a TSH reading, all right? So, we need to have a TSH reading, we need to have a free T4, a free T3, reverse T3 would be really nice because that would tell us a lot about what's happening in another type of conversion. But we want to learn to understand, what those are. And we also want to see how the enzymes are acting as well. And I'll talk about that in a minute. Okay, so back to the TSH. So the pituitary, okay, in the head, in the brain here, sends the thyroid stimulating hormone to the thyroid. Hey dude, wake up, let's go. We need some hormone here. Can you pump it out, please? Okay, that's what it's saying. So thyroxine, which is your T4. So many of you, if you're on medications, you're going to know what thyroxine is because there's a medication called levothyroxine. And it's a medication that's T4. So your thyroid's job is to produce that T4. So it then produces that T4 if it's working optimally. Okay, and again, we're going to go back and talk about what optimal really is, and that's where the blood work comes in. Then what happens is the T4 pumps out, and then T3 is the active form. So remember when I said to you a few minutes ago, I said, okay, factors that contribute to proper production of T4 to T3. Okay, I said iron, iodine, zinc, selenium. I talked about the B vitamins, vitamin C, vitamin D, and tyrosine, your amino acids. Okay, so that helps the conversion from T4 to T3. If these nutrients are not available or they're deficient in your body through nutrition, through lack of nutrition, through not doing the things that you need to do in order to keep your machine running, then the deficiencies are going to show up. Okay, so then that's when we start seeing some thyroid problems. Okay, the TPO is also an enzyme that makes thyroid enzyme as well, so we need to have that enzyme working properly in the body to do the conversions, okay? We also have thyroid globulin, thyroid globulin. That word always gets me. Okay, that's a protein that joins iodine to make T4. Okay, so now that you kind of understand a little bit about, the cascade of the hormones that happen, and then a little bit of understanding of the breakdown, a couple of key things that I want to talk about is I want to go back to testing for a second. So if the TSH alone is the only one that's being tested, and that's the standard care in your blood work, okay? Standard care in the blood work, what does that mean? That means that when you go to your general practitioner, your doctor, they do like their standard blood work, okay? That's standard care. But it's not optimal care. So, and then it's up to you to learn to understand what optimal care is about. That's why we're here. We also talk about optimal care and what things look like and what other tests there are over and above that standard care, okay? So TSH is that standard care testing. I can't say it enough because everybody thinks that's the only one there is. There's not. And I just talked about all the other hormones that the blood work that you can do to have that tested. So I said TSH, T4, free T3, reverse T3 would be great, and then the autoimmune markers as well. Okay, so there's a whole panel. It's not just one. You can't determine what's happening in the pathway of your thyroid health if you're just testing one thing. Okay, so I really want to just point that out. All right, so testing, standard of care, I can't reiterate it enough. We need to look at the bigger picture to learn to understand. So what I said was that the TSH, when I was talking about the hormones, if you didn't catch it, the TSH is produced from the pituitary, and the pituitary is in the brain, right? So the TSH is looking at your pituitary health. It's not actually physically looking at what's happening through the cascade moving downwards, okay? Also, too, what I want to point out, which is super key, is the ranges of the TSH. So maybe you guys actually had symptoms, and then you had your standard of care testing. So your standard of care testing was the TSH, your cholesterol, some other things like your iron, your hemoglobin, liver enzymes, things like that. There's like a whole list of them. And your TSH came back normal, okay? Listen carefully, because I'm going to talk about what that means. Your TSH came back normal, within range, okay? But you were presenting symptoms, okay? So you had symptoms. Now remember, I was talking about what all the primary key, like, top symptoms were at the beginning of the conversation. So then all of a sudden, you still have these symptoms. Now you're like, well, my thyroid's fine. Well, then what is it? Okay, so then what happens is then later on, you go back for your yearly exam, or 2 years later, however you do it. And then all of a sudden, your thyroid is, your TSH comes back abnormal. And you have worse symptoms or the same symptoms, whatever your case is, okay? So everyone's going to present a little bit differently, right? So this is where we look at individualism inside the coaching programs, is to understand who you are as that individual, as that person, right? Okay, so then what happens is now you have a TSH that's abnormal and you have these symptoms. So then technically your symptoms were showing up before your blood work was catching it. And I'm going to explain why that happened. So in standard care, the ranges, so they do the blood work, and then they have ranges. Now you've probably seen your blood work, and you can see like there's ranges on there, and then you've got your test marker that comes back, and then we've got your ranges on one side, and then okay, well it's within range. Well, why am I having symptoms? And then all of a sudden, boom, you're still having symptoms, nothing's resolved, and now your markers are abnormal. Okay, it's because the ranges are too big in standard of care. Okay, now when we test, or if you see like a functional practitioner or someone like myself, like a holistic nutritionist, or someone who works with different ranges, okay, so there's another set of ranges, and there's ones that are above the standard. We have an optimal range. Okay, that means that the gap is smaller. So then, whatever symptoms that you might be having, or maybe you're not symptomatic yet, but we're going to catch it because the range is smaller. Okay, so that's super key. So that's a big difference. And for a lot of different various testings, some of the ranges in certain things are too big. So it's not going to, the doctor isn't going to say, okay, yeah, you know, you have this. Okay, but you know, you're getting symptoms. You're like, why the hell am I getting symptoms? You know, like, why do I feel this way? Okay. Okay, so I wanted to point that out because that's super key in your healthcare practices for you. Okay, one of the biggest things that Coach Penny and I do with our clients is we teach them to advocate their health. Okay, we teach them how to communicate, what to ask for, and when it comes to like this, like standard testing and stuff like that, we tell you what to ask for, in the sense that, like, we know that in the Canadian system, and I'm pretty sure the American system, you guys can correct me if I'm wrong on this, like with the Canadian system, we also have things in Ontario called like the Ontario, I guess, on OHIP. So, you know, that, you know, covers a lot of all the standard of care, right? So when there's things outside of that that are needed, we can give you the guidance to get that. But inside standard care, like, we're obviously going to try to help you communicate as much as you can, so that your things are covered. But when you start looking outside, you have to start paying for those things, okay? But then that's when you're taking responsibility for you and your health and the things that you need to do. You're taking accountability and responsibility for that. And that's what, you know, we're here to help you with, is understand that. What does that look like? A lot of people don't know what that looks like, okay? All right, now before I wrap it up, I want to talk again a little bit just about factors that affect thyroid function. So remember, we were talking about the nutrients that help with the hormonal conversion, going from inactive to active. You need key nutrients in there. So things like iron, iodine, zinc, selenium, vitamin E, the B vitamins like B2, B3, B6, vitamin C, vitamin D, and I said amino acids like tyrosine. Okay. Then we also talked about factors that inhibit function of thyroid, and we talked about that in the earlier part of the conversation. But what I want to point out is that, again, we go back to things that affect the T4 to T3 conversion. So going from active or inactive to active. So the active is the important part. That's what gets the cells to communicate. So your T3 attaches itself to the cell and says, "Okay, let's go, machine. Let's get rocking here. We need to get to work." Okay? Hypothyroidism, that everything is down regulated. It's not working properly. Okay? Where those communications are not happening somewhere in the stream from the brain all the way down that cascade that I've talked about. Okay, so factors that inhibit proper production from T4 to T3. So we talked a little bit about this already, but I want to sum up some more factors and points on this. So stress, we talked a lot about stress, trauma, and Coach Penny does an amazing job at talking about trauma, and when she does her lives and inside our coaching programs, you know, she tackles that component of our clients. Now, people will say to us, and they say this all the time, well, I don't have trauma. Okay, Coach Penny will explain that it doesn't have to be some massive thing that you've gone through that is a quote-unquote trauma. She explains it and says that there is factors that happen along your life that she calls them small t traumas. She calls them like little paper cuts, and they add up and they add up and they add up, okay? That's a big discussion inside our coaching programs that we help clients with, and in the free group here, she does a lot of talks and posts around different things to help with that. Toxins, infections, okay? Certain medications, radiation. So guys, listen to this. With your radiation comes in different packages, okay? Like how often, are you getting x-rays? When you go to the dentist, are they x-raying your teeth every time? Are you getting body x-rays for various things, MRIs? Do you have a microwave in your house? Are you constantly using one of these? Okay, like this is a low grade ionizing radiation. Your computer, your screen times, okay? All that can affect how the thyroid operates. And it's important that we look at how we reduce those types of activities that are happening in our environment, but then also how we're learning to detoxify and support our body through nutrient-dense foods to help remove those toxins from the body. Okay, fluoride. So remember I was talking about water contamination. I'm not talking about like getting sick off of water. I'm talking about what's coming through your taps and that's being filtered from your water companies, okay? They dump chemicals into the water, and one of those things, depending on where you live in the world, is fluoride. Fluoride can affect your thyroid. Does your dentist still fluoride your teeth when you go in? Don't get that. Don't do that. Okay? So say no fluoride, thanks. I'll pass. Does your toothpaste, what kind of toothpaste you're using? Every day when you brush your teeth, it's going to have fluoride in it. All right? So get rid of the fluoride. Okay? Pesticides and autoimmune diseases like celiacs. And then we talked a lot about gluten. You don't have to be a celiac. In order to cut gluten out. I would suggest cut gluten out, period. And I said in the beginning, too, when I was talking about gluten, I said that the gluten attacks the thyroid gland. So again, then we go back to, an autoimmune disease. You can create your own autoimmune disease, okay, just by some of the things that you eat. And one of those things I'm telling you right now is gluten. So, people, our clients and things will resist and resist and resist, that pizza, that when we tell them, hey, listen, gluten's not a good idea, you shouldn't be doing this, blah, blah, blah. And, we can give all the explanations in the world, but really when it comes down to it, it's your attachment to that, okay, to that action. And that's where Coach Penny comes in to really dissect that and get you over that so you can move forward, okay? Okay, so, and of course I talked about other like toxins and things like that in the environment. So these are some of the factors that, that inhibit the conversions. Okay, so, I think that I flapped my gums a lot. Now listen, I hope that with the talk today that you've asked me to do, that it really gives the insight and gives you a bigger picture of how things in things in the lifestyle, including the habits that we do, okay, the things that we do that we're not seeing that we're doing, that gives you a broader perspective on what to open up to. So when it comes to the weight loss and the hypothyroidism, it's not necessarily a standalone problem. And this is why, when Coach Penny and I, when we talk about all the things to do with like the things that you guys are getting diagnosed with, they're not necessarily a standalone problem. There's a cascade of things happening in the body that either shouldn't be happening, the pathway is wrong, or, then there's like deficiencies and all the stuff, okay? So I hope that summarizes nicely some good background. I would love to hear your comments, and if you have questions, park them down below in the comments section. Coach Penny and I are always answering questions inside the group here to help you guys do the things that you need to do. Just remember, if you need help putting pieces together, okay, so as an example, I talked about the 3 pillars of our program. I've talked about nutrition, I've talked about movement mastery, which is exercise, and mental fitness, which is the mindset work. If you need help bringing and bridging pieces together, we're here for that. So we can help you with that. So if you need to have a discussion about that, just feel free to let us know. We're always happy to jump on a call, talk about what options are available to you, what things we can do. We're always open to, you know, at that point referring you to, you know, our best free resources that you haven't seen yet. Our do-it-yourself programs, those are paid programs, and our coaching programs, which are our paid programs as well. So there's lots of options here for you, as well as inside the free group. Okay, guys, have a great day today, and please do leave your comments, and I will see you back here real soon. Take care. Bye for now.